Okay, so I wanted to provide you all with a little bit more information on how to prepare for your OT evaluation in collaboration with PTs, and how we would or might plan to use our assessments to help guide our wellness plan or holistic plan. And so I just want to review the OT practice framework steps for OT evaluation. Um, Again, you all know how heavily I rely on models of practice, and so I hope to show you one that I would use to guide my evaluation sessions and my wellness plan. And so I hope to kind of take you through that. Um, Dr. Schrader and I have done this assignment for so long, and every year we learn something new and we learn tricks of the trade and we learn things through collaborating with our PT colleagues also. And so I want to share some tips on maybe how we can collaborate best with them. Um, Maybe identify ways to help choose appropriate assessments that eventually will hopefully guide you to a really great wellness plan. So methods for evaluating, again, this is review, right, for OT evaluation course. And so we rely a lot on client interviews, right? We do sometimes refer to assessment tools. Some of them are standardized, some of them are non-standardized. And don't forget that a big assessment or way of evaluating is through use of observation skills. And so I feel like observation is highly overlooked when it comes to this assignment and when it comes to evaluating for your client is making sure that you are doing your observation. So I'm going to try and make that a little bit more clear and how you might use observations as a way of assessing or evaluating your client. And in your SOAP notes and those kinds of documentation, it's appropriate for you to say that you evaluated this particular occupation through the use of observation. And so, again, it's something I think I've seen it be underutilized with this particular program. So OT practice framework, okay, and so our OT evaluation, the 3 steps are occupational profile, right? Analysis of occupational performance, and then the synthesis of the evaluation process. And so this is where you all have your resources, right? Think back to OT evaluation. How did we do an occupational profile? Okay, well, I know we use the AOTA's occupational profile template, right? And so in that template, it might help you come up with specific questions to ask that are applicable to your patient or to your client. Now, you know, physical therapists go through a bunch of interview questions also. So when you're planning your first interview or when you're planning your first evaluation session or assessment session, sit down with them ahead of time and say, here's a tool we have. Our occupational profile is going to get that occupational history, right? Like what did the client used to do? What do they currently do now? Some of them are, well, they're in assisted living, and some of them are paying for assistance um, to get assistance with certain activities of daily living. Some of them might get housekeeping that comes in and cleans for them, right? And so that's important for us to know and to get that information in our occupational profile. So that's something then that we know that's being taken care of, right? They're no longer doing that occupation themselves, and so that's not something we would want to focus on. Some of them get laundry services, some of them don't get laundry services. And so again, be thinking about what is their current level of occupation or what are the areas of occupation that they engage in. And what are some of the problems or what are some areas they would like to improve upon? Okay. So that's really important for us to get in that occupational profile. I think the PTs do an exceptional job of also finding out health history from our patients, right? Or I'm sorry, from clients. And so, there is a health history section in our occupational profile. And so maybe if you're collaborating, right, you guys focus on the occupation piece and maybe they focus on the health history. It all goes together though, and it's all really important information to get. The analysis of occupational performance, again, that goes into maybe those different assessment tools that we might do. But this also is where we're doing observations, right? So if somebody is saying, yeah, I do bathing and I do my dressing all by myself, independently, okay, we're getting that information from an interview from their occupational profile. But how are you analyzing how they're performing it? Right now, clearly, we're not going to have them strip down and get naked and, show you how they're showering right then and there. But as OTs and focusing on occupation, we might want to have them show us, take us through their steps that they do, and we observe how they do it, right? So then we're analyzing how they're performing. Are they tripping? Does their balance appear off? Do they have trouble stepping over a tub? Maybe they have a tub shower combination, or maybe they just have a walk-in shower, or maybe they have a shower chair. Have them show you what it is that they use and how they use it. Again, that's your analysis of how they're performing that specific occupation that they've identified that they still do in that occupational profile. Now, here's the beautiful part, okay? This is where our physical therapy counterparts might come in and do a Berg balance or a Tinetti or a tug, right? And they get a score of a, 6, 5, 8, or they fall into the category of a fall risk, okay? This is where then you synthesize that whole evaluation process. Okay, and so this is where things might get a little interesting with, okay, based on our evaluation and observations of them getting out of bed, walking to their bathroom, getting on and off the toilet with grab bars, they appeared to be safe. They were clearly independent in doing so. They haven't reported any issues of falling. They haven't had a fall since moving to the facility. They are independent getting in and out of the shower. Okay, and so then the synthesis is, even though maybe their falls or maybe their balance assessment was showing that they're at fall risk, right? But they have grab bars in their apartment, and they've demonstrated to you that they're safe and independent because you've observed that, right? Then you would talk about how balance might not be affected right there in the apartment, right? And so this is where you kind of use one another to synthesize and maybe prioritize what it is in that wellness plan, right? So you're synthesizing both the PT findings and you're corroborating those with your OT findings, okay? And it's fun because they sometimes counteract each other. Like, oh, they're at a fall risk, right? But their environment is set up in a way that supports their performance. Now you get them outside of their apartment, right? And then that's where, you have that conversation with PT. Hey, their environment is set up in a real conducive way. But they like to go to church out in the community, right? And so how is their balance going to affect their spiritual participation, right? Or their church participation? And if it's outside of the facility, that might give you some ideas for recommending balance types of suggestions or safety types of suggestions in that scenario or that situation. Okay, so again, our OT evaluation, right? If we're really collaborating with PTs and we're talking about these things, it really should end up with a good indication for or specific recommendations for a wellness plan. So, okay, this brings me to the model framework. And so when I think of this assignment, PEOP just comes to mind, and particularly why I would choose this model. It's not the end all be all model, right? Um, but this is what we're bringing. We're bringing occupation, um, right, to the PTs also. And so we want to know, or we want to use a model of practice to be holistic, to be all-encompassing, to view the person through the lens of occupation, right? And so when I look at this model, the reason why it sticks out to me for this particular scenario, or for this particular assignment, is the outcomes. Okay, so person, environment, occupation, participation. So when using this model, the one thing that we want to use it for is to increase well-being, right? To increase wellness. Well, you're coming up with a wellness plan. Okay, and so how can we contribute to well-being? Well, we can increase performance, we can increase participation, and overall, that's going to help with well-being um, and wellness, right? And so our wellness plan, this is already showing us that our wellness plan shows how important participation is. It also shows, how performance can contribute to well-being as well. I'm going to go to occupation. So this model uses occupation very loosely. Ordinary familiar things people do every day that contributes to well-being. So this goes back to um, the the occupational profile template. What is the person engaging in? Okay. Are they showering themselves? Do they cook for themselves? Do they go down for meals so they don't cook for themselves? So finding out what is the familiar things that they do every day, and that contributes to well-being. Do some of them go to church weekly, right? Some of them leave the facility and go shopping, right? And so be looking at and trying to find out what those ordinary and familiar things that people do every day, what those are. And again, since they are an assisted living facility, some of them have plans in place to get assistance for some things as well. So then once we know what occupations they engage in, and it's been my experience with this assignment where, you go in and you ask them, well, what areas, would you like to improve on? And they're like, nothing, everything's fine, right? And you're like, well, I gotta find something. And so, don't worry about that so much. Things will come to you. Again, use the power of observation, right? And if they tell you that they do something, simulate that. Have them show you. When we look at our assessments or how we assess, right, we want to look at all aspects of the person. So cognition, okay, how could we assess a person's cognition? Well, I might, after our occupational profile, I might hold off on assessing cognition until I get a feel on how they are answering questions, right? You can kind of get a sense of how their cognition is. Maybe if you're going through some of the other assessments, maybe you start questioning or you start getting some suspicion that there's some cognitive issues, okay? And so then that might lead you to choose a more formal cognitive assessment. But then ask yourself, by getting a cognitive assessment, how would that contribute? Is it going to contribute to my wellness plan? Okay, so I've had students who go in and they're like, yep, we're going to, on the first day, right, we're going to do the occupational profile, then we're going to do the MOCA, and then we're going to do the mini mental, and then we're going to do the, all these cognitive assessments. And really, if you're just getting a health history and you ask them, hey, how do you spell your name again? Right? I always did that. So even if I knew how to spell it, right? If they could tell me what their name was, they're alert and oriented times 1, right? With cognition. So I would usually say, hey, okay, so can you spell your name for me? And then I'd write it down. And what's your name again, right? Do you know what date it is today? And can you tell me where you're at, right? So those are, person, place, and thing, right? Or person, place, and time. Those are alert and oriented times 3. That's a very simple assessment that you can give on that first day, right? And you don't have to go any further if you don't feel like it's going to contribute to anything. Meaning, is their cognition impacting occupation? Okay. If they're getting assistance already with somebody doing bill paying for them, if they seem to have safety awareness with transfers in and around their apartment, they're not doing any cooking, they're not going out into the community without family support, then what information would a standardized cognitive assessment give you? And it might give you something, I don't know, right? That's that reasoning that you have to play around with. Psychological. Don't give everybody a depression screening, right? Maybe ask them, how are you feeling, right? Do you have a history of depression? Some of that might come up in a health history form. Now, there are certain psychological or depression questionnaires that are available, that are out there. If upon that occupational profile or after a visit, right, if you really think that that's an issue, you can do a more formal assessment if the patient's okay with that. But then again, think about, how is this going to contribute to my wellness plan? Okay, maybe it contributes to a wellness plan. Maybe you recommend that they consult with a psychiatrist, or maybe you recommend that they consult with their physician. Okay, note the interventions below. Consult. Okay. Physiological. So what is their physiology? Okay. What is their neurobehavioral? So maybe, you do some sensory testing. Maybe you just ask them, do you have a history of diabetes? How was your sensation? Maybe you do a quick range of motion, quick manual muscle test of the uppers. Maybe PT does the lowers. Maybe PT does them all. I don't know. Maybe based on their health history, they have vision issues, right? Maybe they have a history of cataracts, or maybe they have a history of macular degeneration. So that kind of goes with visual perception, okay? Again, do you want to spend time doing a visual perceptual assessment tool? You might, right? It might contribute to your plan. You might recommend that they maintain appointments with their eye care professional, right? You might create a low vision handout for them based on, I don't know, something to help maintain their function. I think one year we had a group that the person had macular degeneration. They used their microwave still for like microwave popcorn and that kind of stuff for a snack. And so then they used some kind of a felt tip, right? And they just placed it, with permission from the client, of course, and after they educated them, a felt tip on the popcorn place on the microwave. So instead of using their vision, they could just feel where it was. So again, some of these things you can use a standardized assessment. Some of them be thinking about, can you just observe? Can you interview them? Spiritual, what does spirituality mean to the person? So this is a wellness plan, and so there should be a spiritual component to it, okay? Some of them might go to church weekly, right? They might go with family and they go to church weekly. Okay, that might help maintain their spiritual part of themselves. And so, maybe it's not an issue, or maybe it's not an area you focus on, but spirituality is a big component of wellness, right? And so maybe in your wellness plan, you simply have them continue weekly church services because it maintains that sense of spirituality and perhaps contributes to that social piece or social interaction of occupation. So that, again, when I'm looking at occupation, it goes back to the occupational history, right? And now you're assessing the different different areas of the person. When I'm seeing or when physical therapy is involved, right? They're certainly doing a lot with physiological, neurobehavioral. And so even though this isn't their model, right, the data that they collect surely is going to fit in and give you a picture of different parts of the person. But then don't forget, as an OT, you bring in some of those other pieces of the person too. Environment. So as with the environment, we know as OTs just how important it is. And so with the PEOP, we're looking at culture. Um, there's a culture of assisted living, right? There might be a culture depending on what facility where you're at, right? There might be a very strong Christian culture or a Catholic culture or a Lutheran culture, okay? Or there might be individual cultures, right? There might be individual or people of different cultural backgrounds, and that might impact occupation as well. Social. And so I think the social environment is really important, especially in assisted living facilities. I smile because I know how important it is. Cutting off at 4:45 is super important so that they can get to their dinner time. And some of them will want to get down there early so they have that social interaction with their table mates and such. Environment. So there might be policies in place too that are with those assisted living facilities. And so it's important that we're kind of aware of what those policies are, especially related to HIPAA or relating to who can we talk to about this person. Those are all related to policies. The physical environment or natural environment, again, power of observation. You're going into their home. You should be able to do some kind of assessment on that physical environment and see how they're performing in that environment. Okay. Assistive technology is here as well. Do they have current assistive tech that they're using? You can use assistive tech with adaptive equipment interchangeably. Okay. Um, but I've seen a lot of people in their wellness plans actually look at additional types of assistive technology to increase their participation, increase their performance, which contributes to their well-being. Okay, and so that's really cool. Now, this particular model also using PEOP, there's certain interventions, create, promote. Maybe you create or you're going to be creating a wellness plan for them that's unique and tailored specifically for them. Okay. Establish, restore is an intervention for this particular model. I just would use caution with it. I've seen students that want to restore a function that once was lost, and since we can't follow through with it, right, we don't know if it's going to continue to work. And so I would, since we don't have follow through with these people, with the establish, restore type of intervention, I would use a little bit of caution with that. Maintain. Maintain is going to be really important. Again, I think I used the example already, right? How is the person's spirituality sense, right? Or what do they do to exercise the spiritual part of themselves? Some of them might go to church services weekly. So we might say, hey, maintain your spirituality by continuing to go to church weekly, right? So I mean that's kind of a simple thing, but I feel like spirituality sometimes on these wellness plans are dropped off and forgotten about. And so don't forget that you can say, hey, continue this, right? Continue your social or continue your weekly card playing game with your bridge club, because that contributes to your social interaction, right? Which contributes to your well-being, okay? So don't, depending on how long and lengthy your plan gets, right? Don't be afraid to say continue this activity or continue this occupation, because it will maintain something. Modify compensate is something you may choose to do. If you're going to modify or compensate or modify anything in their place, you have to get permission from the site first. And that site may want to talk to the family first, okay? So it just, you may teach them compensatory skills or compensatory strategies, right? But we just don't want to go in there into their home. And we've had clients say, yeah, that's fine. And then students have modified something in their environment, and then, oh goodness, that all just kind of ruffles feathers. And so we want to be a little cautious with modify also when it comes to modifying the environment. Preventing, I hope we prevent, right? Pick up the throw rugs, prevent falls, okay? Now we don't want to make that blanket statement over everybody. Some people do just fine with throw rugs. Again, we would want to assess that, right? Maybe their balance and maybe their ambulation that we get from PT, right? Maybe that is affected. And so then, in their environment, that might be something that we do recommend to prevent falling. There should be a strong education component that we're doing as well. And that education piece really comes into play with that wellness plan, right? We're going to be educating them on their wellness plan. I've seen a lot of wellness plans where students make these beautiful recommendations, but they don't explain why, or they don't explain the rationale in patient-friendly terms. And I get it, right? The wellness plan can be a really big document, but we want to make sure that they understand why they're doing or why something is important. What's it going to contribute to? Okay. And then consultation. So some of you might find something that's really alarming. Okay. And so last year or one of the years, there was, I think some of the PT students had some concerns with a person's blood pressure and heart rate, right? And so they do blood pressure, heart rate, they do those vital signs before every session, which thank goodness, right? Thank goodness for that, because one of the ladies was having some cardiac issues. And so we had her consult with her physician, right? And so we called we called the site right away, right? We had the activities person come, they called a nurse to come, right? But in the wellness plan, right, we had a recommendation to keep consulting with, right, their medical provider. And I believe they recommended that once she was stable, she asked her medical provider if outpatient physical therapy would be appropriate to work on endurance and safety, those kinds of things with her balance. And so if you do find something that's concerning, right, it might be just simply a recommendation. Since we're not going to restore something, or if we're not going to restore something, we can still recommend that they consult later on with a professional, okay? Okay, so for collaboration, again, I've talked to you a little bit already about how our occupational profile probably gets some of the same information that the PTs are looking for, especially health history, and vice versa, right? So as you're planning, communicate what you need to do. We need to do an occupational profile. Well, we need to get a health history. And so there's been sometimes in the past where that first session just ends up being students talking and interviewing. And they're essentially, the PT students are finding out health history, the OT students are finding out health history. So communicate with each other. What is it that we need to do? use your resources, pool your resources, modify your resources a little bit so that you're managing your time. So again, that communication, what do we need to do? So there's some things that we need to do as OTs, we absolutely need to do for the sake of the assignment. And there's some things PTs have to do for the sake of their assignment. So also communicate what has to be done, okay? And then think about how are we going to manage our time? How can we work in conjunction with one another, okay? And so maybe OTs, we like to look at the physical environment. We like to assess that, right? And so maybe if PTs are doing manual muscle testing on lower extremities or whatever, maybe the OT students then can say, hey, would you mind if I take a look around your place and just get the layout and see what kind of layout you have here? Okay, so that, again, that would be dividing and conquering. That way you're doing some kind of explanation of their physical environment. You can be getting some of that health history. You can be getting some of that occupational history during some of the standardized assessments also, right? So don't just think of occupational profile interview first, right? I mean, do your introductions and those sorts of things, of course, and spend a little time building rapport, but don't be afraid to get in there, right? And to get what you need. Some of these people just love company and they will talk your ear off, right? And so, practice that skill of, well, show me how you do it, right? Come on, show me. Or sometimes like with the home assessment and those kinds of things as a recommendation for a type of assessment, what I liked to do is after you get a little bit of that health history, an occupational profile of, okay, so you bathe yourself, you take yourself to the bathroom, you get in and out of bed, you get yourself dressed. Can you show me in your apartment, like show me how you walk through those different steps? Okay. And they'll be like, what? Like, take me to your bedroom, right? Get in and out of bed. Show me how that's going for you. I just want to be able to observe how that's going for you, right? And so have them do it for you. Again, I mentioned before, don't have them strip down naked and get a shower, but say, hey, I just want to see how you get in and out of the shower. Do you have any issues with this? How is it going? Okay, so as they're doing that for you, you're assessing their home environment, but you're also observing those occupations, which are really important for analysis of occupational performance. Okay, this is where observation is so underutilized here. And then PTs, right, they should be able to observe how is their posture with ambulation? How many steps are they? What's their activity tolerance? Okay, and so again, that's managing your time, working in conjunction with one another. Hey, if I have the client do this, we can have the home safety. Are there certain things also that you would be able to assess by having us do this particular concept, right? Explaining rationale is really important. So what preliminary results of one session, let's just say of one session, will inform your second session? And so this is where I've really struggled and maybe been a little frustrated. I've had students who have in the past been, I have to do a standardized assessment. Physical therapists do nonstop standardized assessment, and I haven't gotten any information yet. My PTs are using all the session to do the stuff that they have to do, and I haven't done anything. So I'm going to do the 9-hole peg. And I'm thinking, why are you doing the 9-hole peg? Where is that? What does that have anything to do with anything, right? And so please explain your rationale. What did you see in that first session, or what did you see in that second session that would say, I need to investigate this a little bit further so that it helps me come up with a recommendation for my wellness plan. So for that particular instance, I was like, I don't understand why you want to do the 9-hole peg test. Did she have a stroke? Like in her health history, she didn't have a stroke. She didn't have, well, no, she had a broken finger And so she has like a flexion contracture of her DIP joint. And I said, well, how does that impact occupation? Does she have a hard time doing dishes? Well, I didn't know. We didn't ask. Well, does she have a hard time um, holding a glass and getting a drink of water? No, we didn't ask. Does she have a hard time holding a fork and cutting with a knife? Um, no, we didn't ask. So then what is this 9-hole peg going to offer you for your wellness plan, right? The purpose of the 9-hole peg is used as an outcome measure for coordination, right? And so you might want to work on, with 9-hole peg if somebody had carpal tunnel or they had something neurological going on, right? You might get that data of how fast can they transfer pegs back and forth, and you might compare that to the normative data and say, yep, they're a little bit slower than their mean age, so we can work on coordination to speed up time, right? But for this particular patient, I docked them points because it didn't, how can I explain it? If I have a slight flexion contracture of my DIP joint of my finger, and it's been like that for the last 20 years, what's the point of increasing fine motor coordination? And I mean, it's not like we're going to fix the contracture. Okay, we're not going to restore range of motion. It's contracted that way. Okay, we're not restoring anything. It's not contributing to her occupational performance. And so would it be better information if we said, show me how you button your shirt? Okay, is that working okay for you? Because I would imagine a DIP flexion contracture, it might be hard to button. And if that's the case, we're not going to improve that, but could we teach her compensatory strategies on buttoning if that was an issue? Okay, if she had a hard time using a knife and a fork, might we suggest larger handled utensils? Or might we suggest some kind of adaptive equipment, right, to help compensate for that contracture that we're not going to do anything with? Okay, and so think about how the results of your assessment that you're choosing is going to impact your wellness plan. So again, 9-hole peg, is that going to increase or is that going to cause any guidance? Is it going to provide you with any guidance on your wellness plan? Or just observing buttoning, observing utensil use, interviewing them about their occupational profile and history, and observing her hand use with those things, that's going to tell you a whole lot more on what you might specifically recommend for their wellness plan. So again, if you get anything out of this, it's observation, right? And the use of observation for your assessment. Don't feel obligated to specifically use a standardized assessment. Okay, don't forget we're OTs and we can assess things many different ways. Again, prioritizing is going to be really important. So in your assignment, I copied and pasted these different ideas, right? And so again, these are ideas and possible recommendations, but it really is going to come down to how applicable they are to your patient or your client. So again, your visit 1, interview occupational profile. Okay, so be getting that occupational history. What's their current level of function? Okay, what was their past level of function? You might be able to do some range of motion strength testing. Again, you're just getting to know them. And so sometimes, to me, a nice flow of things might be do your introductions, say, hey, while we're here, would you mind showing us around your place a little bit and helping us get the layout here? And then as they're showing you things, maybe ask them some of those interview questions or ask them some of those occupational profile questions. That way you're really managing your time well, You're able to assess safety, you're able to assess gait, you're able to assess posture, you're able to assess safety in their home and their physical environment. And so while getting all that information you need for the occupational profile and health history. So visit 2, safety assessment. And again, this is all recommended. And so if you did your home assessment right earlier and you watched those basic transfers and you watched how they got in and out of the bathroom in the shower, maybe you saw some red flags, right? And so that might guide your visit 2 for PTs to go, we're going to do this gait assessment, or we're going to do this endurance assessment, or we're going to do this balance assessment. Okay. And so I think that, that's your visit 1 result should guide your visit 2 results somewhat. So it doesn't seem so like throw a 9-hole peg in there out of nowhere. Okay. Cognition maybe. So if you did see some things with visit 1, maybe you want to look at cognition or maybe some mental health or depression screens. But again, maybe you already assessed some of those things. Alert and oriented ×3, right? Or patient reported they're not having any depression at this time, right? And so that might come up in your occupational profile, and you would say that you address that at least through interview, and that's not necessarily going to be a direct focus of further assessment. Visit 3, maybe you're looking more specifically at ADLs and IADLs. So maybe you do notice some things with balance, right? And so this might be something where you're like, yep, okay, so we notice discrepancy in shoulder flexion, right? We notice some discrepancy or we notice some balance issues in the home. And so now we're going to focus more on that shower transfer. Right? And so again, this might be where you really are observing those very specific activities of daily living or IADLs that are most applicable to your patient. Again, if they don't do laundry, don't focus on laundry. We did have a patient one year that did their own laundry, and there were some balance issues, right, that PT came up with. In their apartment, they were fine functionally, but it was a great collaboration between PT and OT to come up with strategies on maximizing safety and independence with the patient transferring their laundry to the laundry room. It was a great collaboration. So again, your visits, right, should build on each other. So it's not just randomly throwing in willy-nilly assessments for the sake of doing assessment. And always be thinking about, is this assessment going to help me come up with something to recommend for their plan? So then when we get that final SOAP note, right, and your wellness plan, remember your results of your assessments need to be in there. And some of that assessment results, I would anticipate, I would hope, does include that it was observed, right? If you didn't observe it, it didn't happen, right? And it needs to be documented. If it isn't documented, it isn't real. And so that note needs to be pretty detailed, but then your wellness plan, I should be able to look at your SOAP note and then say, oh, there was a discrepancy with range of motion. It was affecting, again, going back to your synthesis of occupation or synthesis of the OT evaluation, right? I should be able to see, oh, range of motion is affecting their ability to wash their hair in the shower. And so then your wellness plan, right, should have something. Maybe there's some adapted way that they can wash their hair, okay? And so your wellness plan needs to directly relate to the results you found in your assessments. If there's something that is in the wellness plan, patient to continue church weekly with family, blah, 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 but that wasn't included in the interview, then it doesn't what do you mean they need to continue? Where at in their note did it say that they were doing that as part of their spirituality? Okay, and so make sure that your notes, okay, make sense as to what you're recommending. Your wellness plan needs holistic, okay, or it needs to be holistic. So use your model of practice and then see how PT adds to that also. Okay, they have a nice piece to that puzzle also. Um, and it's going to be us that might kind of look at mental health and cognition and spirituality and contribute some to that physical part, but they really have that much more detail with ambulation and balance and safety from that perspective. So that's so great how they add that. Our wellness plan should include recommendations, right? I shouldn't say, well, I put interventions because our model of practice that I chose, PEOT, looks at preventing. So are our recommendations preventing anything? Are our recommendations maintaining something that's important to contribute to their well-being? Okay. Are we providing any education? Gosh, I hope so. Okay. Are we promoting independence? Are we promoting safety? Is there anything to adapt? Maybe teaching them adaptations, right? Is there anybody they should consult? Maybe they should consult with an outpatient physical therapist for continued treatment or monitoring, or OT, right? Is there anything we can advocate for them to receive services, or can we advocate for them in some way in their facility, and any others? Again, I left the establish, restore piece out, not saying that we wouldn't do that, but refer back to our model and keep these into consideration when coming up with your wellness plan. The biggest thing is your wellness plan user friendly for the client? Okay, it's not uncommon for there to be visual issues or visual concerns, and then I get their wellness plan and it's like 9-point font, right? Or it's really beautiful colors that are blue and light orange to represent University of Mary. But I can barely see the light blue, and if they have macular degeneration or cataracts for that matter, they may not be able to see it. And so make sure, right, that it's user friendly with font, with size. Okay, I've had one group that had like a 50-page wellness plan one year. No, that's too overwhelming. Okay, so really prioritize, make a couple recommendations or make the most appropriate recommendations, but make sure all aspects of that wellness is somehow addressed. It's not uncommon for people to recommend adaptive devices, adaptive equipment, assistive technology. Give them a nice picture to look at of what it is, a specific place to purchase with the price. Okay, that way they have that resource that they can access it, or their family member can access it. And then another tip that I have for your wellness plans is make sure that they understand why you're recommending what they're recommending. I have had some people that have done more cognitive assessments, right? And the students recommended like Sudoku puzzles and word finds and provided some of those in the wellness plan, but didn't indicate as to why they were recommending those. And so maybe it's to maintain cognition, or maybe it's to um, um, help with leisure. Again, looking at areas of occupation, I suppose. There really was no rationale as to what the importance was. Um, Also, going back to pictures, pictures are worth 1,000 words, right? Especially, your PTs, or maybe you might recommend specific exercises to do to maintain range of motion or to maintain their current level of balance, those kinds of things. And so look at maybe some pictures to help explain some of that too. Okay, so make sure it's user friendly. Also refer to your assignments and rubrics often. This is a beast of an assignment. You've got the holistic plan, you've got the wellness plan, you've got visits, you've got notes, you've got communication with your faculty. There's a lot going on, and rightfully so. I mean, when you're an outpatient or when you are working in a skilled nursing facility or a facility like this, you do have a lot of those things going on all at one time. And so this is such a great assignment for that. Anyway, I hope these tips help. If anything, you have that model reference to look at. And we will see you soon.